So do you think that fungus is pretty much gone and that's just the remnants, or do you think it's still active?
In the toenails? Hard to know.
Okay.
Could be either. You good?
Mm-hmm.
Okay. Did you get his question?
Mm-hmm.
Okay. It could be either sometimes the toenails are just thick because they've been hitting the front of your shoe your whole life.
Mm-hmm.
Sometimes the toenails are thick because of the fungus.
Okay.
And really the only way to know absolutely for certain is to send a sample in and have it cultured.
Oh, okay.
And then the only reason to do that is if you think you would want to treat it if it came back positive for the fungus.
Mm-hmm. Okay.
So if we can keep them thinned out and comfortable, then I guess it kind of doesn't matter, right?
Right, yeah, that's fine. Okay.
And if at some point you want to do the test, we can definitely do that.
Okay.
So I have to tell you a funny story because when all of these clinics were phasing out doing routine care, and the podiatrists weren't going to do it anymore, and even most of these clinics had trained foot health nurses or medical assistants who would do it, then the doctor would come in and look and say, good job, and you're on your way. But at a meeting a couple weeks ago, or a couple years ago, I was talking with one of my colleagues from one of the big clinics and asked why they weren't doing it anymore. And he said because the nurses union stepped in and they were concerned about the nurses getting carpal tunnel syndrome. That's why they weren't doing it anymore.
Wow. Never in a million years would have guessed that.
Well, it's not true. Because if you train a nurse and have her doing this 1 day a week, it's not going to give anybody carpal tunnel syndrome.
True.
But they just didn't want to do it because it doesn't make enough money.
That part again.
Yeah, they would rather have you come in when you've got the raging infection and they can admit you into the hospital and put you on IV antibiotics and take off your toe. That makes money.
Yeah. Wow.
So this is me on my soapbox, and I just get really angry that these people are not taking care of their patients.
Well, you're commended for being so concerned about your patients.
We're small. We're like a family, all of our patients and us.
That's wonderful. Good.
Yeah, and believe me, I've got patients who have been coming in every couple months for, better part of 2 decades. So it kind of does get that way.
Yeah. And what are you thinking as far as some type of lotion or something for my feet? Is there?
Yeah, we have, there is a cream that I can, there's lots of options.
Okay.
So there are some creams that have components in them that help break down some of the callus tissue.
Okay.
You may just be a big callus former, and this is just something you're going to have to manage. Like you got to shave every day.
Right.
Because you're a beard former.
Yeah, I do tend to develop calluses, so.
Yeah. So what I can do is I can definitely prescribe one of those.
Okay.
I usually carry it here. I'm just out right now.
Okay.
But we can do it with a prescription, and using it once a day will help keep the calluses down.
And is there something just for overall feet, the dryness and so on that?
You want to come behind? Something for just this cream will do that too.
Okay.
It's a very strong moisturizer that helps break down the thick skin.
Okay. Great. Do you think that the way nails grow, I could go every 2 months without a trimming, or do you think I need to come in between to see you just for a trimming?
Well, most people don't even need to come every 2 months. That's
Okay.
that's a little bit soon. So usually where I start people is at 2.5.
Okay.
So have you back at 2.5, unless you're concerned, then we can make your next
right.
appointment
Okay.
at 2 months. And then we reevaluate. Now, some people will come in every 4 to 6 weeks, and then they just pay out of pocket for every other visit,
Right.
and Medicare picks up every other one.
Yeah, I'm fine with that too. So it's,
Okay. Well, why don't we start at 2 months?
Okay.
And you'll let me know if that was too long in between, or if that feels just right, or if you could have gone longer.
Right. Sounds wonderful.
My goal is to try and keep you out of here as long as possible in between appointments, so
Okay.
the longest we can go that you stay comfortable is generally what we'll do.
Okay, I think 2 months is a good start, and then we'll take it from there, so
Okay.
great. Good.
Alright.
You know, I'm a pretty open person about things, and this is the only medical procedure that I've actually been embarrassed about, to come and see a professional. And it's just, it's odd, it's sort of like I'm not able to take care of myself. So I appreciate your compassion and concern, and
Well, thank you.
just your manner and how you're doing this.
Thank you, and just know you're not alone. Lots of people feel that way. Let me see if I can do it. I can do it from here. People who watch these videos on YouTube, it's mostly a younger demographic, and they're irate because they don't understand how could somebody not take care of themselves and come in looking like that. And what they don't understand is that it's something as simple as, oh, I had a knee replacement and I'm doing fine, but I can't bend my leg enough to get down to it. And I can understand it's almost like a loss of independence, and you know, can be pretty disconcerting. So, all right, I'll switch with you.
You get film credits.
They all know me.
Yeah, it's be hard for you to go through Byerly's and people going, I know you. And I'm putting away my do-it-yourself callus grinder at home. At least I don't take any more skin off now that I found you.
You know, the thing is that those are fine if you have good feeling in your skin,
Yeah,
which you don't.
no. I'm just grinding away and then it's like, ow! There's blood, and that's not good.
Oh, where did that blood come from? Yeah. And this is what he's talking about right
Yeah,
here.
I
So.
got a little high on my, this is the best part of the whole thing right here.
Right? Little massage at the end.
Absolutely.
All right. So everything here looks really good.
Oh, good.
So we'll get you set up for the 2 months.
Okay.
And again, that doesn't mean that if something happens that you can't come in sooner.
Oh, yeah,
so.
absolutely.
Okay.
I appreciate that. Thank you.
Well, yeah, thank you for letting us include you.
Yay.